Hi, we're Usman and Sarah, and we're part of the pharmacy team here in Velindre. This video is about a group of medicines called PARP inhibitors, which are taken by mouth as a tablet or a capsule and are used to treat different types of cancer. You can recognise them by their names, which usually end with RIB. Throughout this video, we will refer to them as PARPs. During this video, we will explain how to store and take your PARP medication, how to manage some of the side effects, when to take medicines to help you with these side effects, how to stay well at home, and when you should contact us for advice. Sometimes, when you're unwell, you will need to get advice quickly, so we will explain who to contact and when you should do this. The most important thing to remember is that you are not a burden. We want you to contact us if you feel unwell, because the earlier we know about your side effects, the easier they are to treat, helping you to stay well and stay on your treatment. It is not possible to list every side effect that may occur. If you're feeling unwell with new symptoms or have a symptom that is not explained in this video, it is important that you contact the treatment helpline straight away for advice.
Your oncology team includes your consultant, specialist pharmacy professionals, nurses and doctors. During your outpatient clinic appointments, your team will speak to you about your treatment and provide you with written information. It is important to read this carefully. Reading it together with a family member or friend may be helpful. Write down any questions or concerns you might have and bring these to your next outpatient appointment for discussion with your team. You should always store your medicines in their original packaging in a cool, dry place, below 25 degrees, safely away from the reach of children. Your pharmacy will let you know if your medicines should be stored in a fridge. Your PARP treatment will be given to you in medicine packs. That will either be a pot or a box. Each of these packs will have a label printed on the outside to let you know how many tablets or capsules to take and how often you should take them and for how long. Always read the instructions on the label before taking. It is best not to touch your medicine if you can avoid it, so take it by popping it straight out of the packaging into the medicine pot provided, or into a small cup that you keep specifically for taking your PARP, and take without touching them. Always take with a glass of water and swallow whole, do not chew. Do not take if the tablet is broken or damaged, and be sure to wash your hands afterwards thoroughly. Take them at approximately the same time each day. You may also be given other medicines to help manage the side effects of your treatment. Never share your medicines with anyone else. Any unused medicine should be returned to the hospital pharmacy for safe disposal. Do not start any new medicines or supplements whilst you are taking your PARP treatment without checking with your oncology team, and this includes anything you may buy. You should always show your treatment helpline card to any healthcare professional that you see so that they know the name of your PARP. If you are not sure how to take your medicine, you can ring the hospital pharmacy or treatment helpline for advice.
Sometimes, PARPs may interact with certain foods such as grapefruit or other medications. You will be told if there are any foods or medicines you should avoid. You should not take any herbal medicines whilst you're on this treatment. If you have taken more of your medication than prescribed, contact the treatment helpline for advice straight away. If you are sick, do not take another dose to make up for it. Just take your next dose at the usual time. As a general rule, if you forget to take a dose but remember within 2 hours, then take it. But if it's more than 2 hours late, miss the dose and take your next dose at the usual time. If you're unsure, contact the treatment helpline for advice.
Common side effects of PARPs include altered blood tests, feeling tired, loss of appetite, feeling sick or being sick, also called nausea and vomiting, and diarrhea. You will have your blood checked regularly during treatment, as it can affect your blood count in several ways, including reducing your white blood count, which increases your risk of picking up infections, and therefore ensure you have a thermometer at home whilst on this treatment. If you have a temperature below 36 degrees or above 37.5 degrees, or if you have symptoms of infection, then you must contact the treatment helpline straight away. The medication can also reduce your haemoglobin levels, which may lead to you becoming anemic. Let your team know if you feel extremely tired or short of breath, dizzy, or if you are looking extremely pale, as these may be symptoms of anemia. It can also reduce your platelets, which help the blood to clot. This will increase your risk of bruising or bleeding. If you notice any excessive bruising on your body or bleeding when you blow your nose or brush your teeth, you should contact the treatment helpline for advice.
Feeling tired, also called fatigue, can have many causes. This can be more significant if the medication causes a reduction in your red blood cells, called anemia. Some pain medication can also contribute to fatigue, as it can make you feel more sleepy. Your team will speak to you about your energy levels before you start your treatment. This will help them monitor how you're feeling during treatment. You will have regular blood tests, and your team will let you know if the results show low levels of red blood cells and how this can be treated. Carry out normal activities, including gentle exercise. This might be walking around the house, going out for walks, or more strenuous exercises if this is normal for you and you feel able to do so. If you feel tired after exercise or normal activities, listen to your body and rest if you need to. If you feel unusually tired, take care of driving or using machinery. If you don't feel better after rest, or you're spending more than half a day in bed, or you're unable to complete any normal activities, please contact the treatment helpline.
Feeling or being sick, also called nausea and vomiting, can be a common side effect of treatment. It can make you lose fluids and make you feel tired and unwell, and can make you lose your appetite. Changes to your taste may also make you lose your appetite or feel sick. You may need to obtain some anti-sickness treatment from your team or your GP if you feel nauseous all the time. Take your anti-sickness tablets according to the label. Avoiding fatty or fried food, eating small meals and snacks, and drinking plenty of water can also help to settle your symptoms. There are lots of medicines that can treat and prevent sickness, so if one medicine is not helping you feel better, make sure you let your oncology team know and they can prescribe a different treatment that could be more helpful for you. If you were sick more than once in 24 hours, if you are not feeling better after a day taking the anti-sickness tablets, or if you are unable to eat or drink, please contact the treatment helpline.
This treatment can cause you to have diarrhea. If diarrhea goes untreated, it will cause you to lose lots of fluid, which can make you feel weak and unwell. If you experience diarrhea, start taking loperamide if it's been provided. If you do not have any loperamide if you have diarrhea, you will need to obtain some from your team or your GP. You can also buy this from your local pharmacy. Take 2 loperamide at the onset of diarrhea and then 1 after each loose bowel movement, with a maximum of 8 in 24 hours. This can help settle diarrhea symptoms. Until your symptoms settle, avoid fresh fruit and vegetables, and try to drink extra water to help stay hydrated. Avoid alcohol and caffeine too. Alcohol is dehydrating, and caffeine can stimulate your bowels, so they can make your symptoms worse. Contact the treatment helpline if you have more than 4 episodes of diarrhea in 24 hours, despite taking loperamide, if you have cramping pains in your abdomen, or if you have symptoms that last for more than a day.
You may lose your appetite whilst on treatment or find that food tastes different. Your team, including the dietitians, can give you tips to help with this. Try to eat small meals or snacks throughout the day to help keep your energy levels up and to prevent weight loss. Keep a record of your weight at home and let your clinic team know if you are losing weight when you speak to them at your outpatient appointment. It is important not to get pregnant or to breastfeed whilst taking PARPs. Women of childbearing age and men with partners of childbearing age should use effective contraception whilst on treatment and for several weeks after. Your team will tell you how long you should avoid this. If you were offered immunisations whilst on this treatment, please contact your team for advice before accepting any vaccines.
Having cancer can increase your risk of developing a blood clot. Contact the treatment helpline or attend your nearest A&E straight away if you notice any of the following symptoms: swelling, heat, redness or pain in your calf, or any new or worsening shortness of breath, any of which could be a symptom of a blood clot. Don't forget, It is not possible to list every side effect that may occur with this treatment. If you are feeling unwell with new symptoms or have a symptom that is not explained in this video, it is important that you contact the treatment helpline straight away for advice.
If you need to contact Velindre, contact Velindre Cancer Services switchboard on 029 20 615 888. If you are unwell, ask for the treatment helpline. If you have any general queries about your treatment appointments, contact Velindre and ask for the booking line. If you have any general queries about your clinic appointments, contact Velindre and ask for your specific consultant secretary. If you have any general queries regarding your medication, contact Velindre and ask for the pharmacy or the treatment helpline if the pharmacy is closed. We hope you found this video helpful. We can't list all of the side effects, so please refer to the Electronic Medicines Compendium for more information or ring the pharmacy at Velindre if you have a general query about your PARP inhibitors.